Hello and welcome back. Today we are joined by Alan Scott, who is Head of Physiotherapy at Hampden Sports Clinic. So thank you for joining.
No problem at all, thanks for having me.
No problem. So I've known you for a number of years, but I've never actually found out much more about you. So whereabouts are you from originally?
I'm from Glasgow, so I grew up in Glasgow and work in Glasgow as well there. I've had a little bit of a year down in Northamptonshire a long time ago, but majority of my work and living life's all up in Glasgow.
Right, okay. And then how did you get started into this area in terms of physio?
Oh, so probably when I was 14, most people I think that get into physio tend to have some degree of sports background. So when I was younger, I played a bit of football, not at any great level or so, but I had a few injuries, a few knee injuries, a few surgeries by the time I was 14, 15, and probably never really recovered particularly well. So I actually ended up working with 2 or 3 physios at different football teams I was with at the time. So that kind of got me interested, and I got to the stage thinking, well, I'll never be good enough to play, but how can I get involved in sport at an elite level? And the way in for me was physio. So when I was 17 then, leaving school, again got my hires and decided to go into physiotherapy that way. And so 17 started at Glasgow Caledonian Uni, and then right through to 21 when I qualified. And from there, I've been lucky enough, just the usual background with working in NHS and then trying to do little bits and pieces of sport to build up my experience. So I've been quite fortunate, and my career's probably went down the sport route relatively early, which I'm very, very fortunate and lucky for.
Yeah. Who do you support?
Scotland. I say no more. And I work with them at the moment, so I'll go with that.
Yeah. Good answer. So in terms of when you chose to do physio, was it a competitive to get onto that course?
Yes, I think again at the time going in at 17, you're probably unaware of how competitive it is. Again, you do a bit of research for the course. You go to, I maybe applied to 5 or 6 different institutions. Was fortunate enough to get into Glasgow, which I stayed in anyway, Glasgow Caledonian. I think at the time I maybe didn't appreciate how competitive, but when you speak to people and you find out how many have applied that maybe didn't necessarily get into it, who then maybe did other kind of health professions, then I think it was, and it's certainly getting more competitive the more people are getting interested in it. So whether or not I'd get me my grades now, I'm not so sure.
Yeah, and in terms of like the hires then, so just again, I know people that have taken them, but how does that, well, what do you actually get when you're doing a hire? Because I've done that with A-levels.
A-levels, right, so again, they're slightly, I believe the system might be slightly different now, but at the time when I was at uni, you would get 6 points for an A, you'd get 4 for a B and 2 for a C, and you had to reach over the course of, we do hires in 5th year and 6th year up here, so you get kind of 2 goes. So I think I ended up with seven of them. And what you do is you add up your points essentially. And some courses will stipulate that they require X amount of points for you to get in. And then once you do that, you go through an interview process with someone at the university. And then at that stage, they will either offer you the position or not offer you as well. Slightly different in other universities. Some are harder to get into than others. But the one I got within the 2 years of the hires, I was fortunate enough to get pretty much right on the money as far as the points I needed. And then I was able to get into the course there. One thing I probably would say is I never did biology at school, which I probably should have done. Again, when I hit 5th year, and when I was 15, 16 years old, I wasn't sure about physio. It was something, as I say, I was going through rehab at the time, but it wasn't like a burning ambition at that stage. And I think having done first year, when we did physiology, a background in biology would have been a big, big help. But got through it and ultimately anyway.
Yeah, and then in terms of that, then, so you're saying about potentially having done a slightly different background for getting into there, but was the course what you expected, and did you have an idea of what you wanted to be working in afterwards?
It was probably, I think it was harder than I expected. And there was certainly the first couple of the years, the way the course was, it was very, very information and sort of text-based. You had to learn, you had your Palestanga anatomy, you had your physiology. It was a lot of information loaded. We didn't tend to see an awful lot of patients until we got to 3rd year. And even now, I would probably class myself as got a hands-on physio, so I quite enjoy that side of it, working with patients in rehab. So I found the first 2 years probably tougher than I did the second 2. Once we got out seeing patients and we got into hospitals and did different rotations, I really started to enjoy that with it. And there was a little bit less of the kind of academic side of it from there then. So yeah, it was definitely a tough course, but certainly rewarding from what I did.
Yeah, and it's a 4-year course.
Yes, I think it maybe slightly differs down south. Is that correct? Is that a 3-year course?
Yeah, 3 years.
Yeah. So I think I'd applied for, I'm sure Manchester actually was one. I think Newcastle. It's a long time ago. I've been qualified. I won't even tell you, but it's more than 20 years anyway. So it's a wee while ago, I remember. So it's a 4-year course up here, straight. Yeah. And after that, you can go in and do any kind of masters after that. Or I essentially went straight into working with the NHS at that point.
Yeah. Oh no, very good. And then in terms of that, then, so your placements, then, where did you do for those?
Most of it again was around sort of west of Scotland, so we'd been in the hospitals. There's been a slight change within the way the hospital system works up here at the moment, that they've actually reduced the amount of hospitals and increased the size of 2 or 3 main ones within the area. So actually we were quite lucky that we got a mixture of, at that time, working in the slightly bigger hospitals and working at your more community-based ones. So you'd maybe see in the community-based hospitals, it might be elderly rehab, it would be maybe stroke rehab you would see. In the larger hospitals, you'd be working more respiratory, working medical, worked in, one of the ones I really enjoyed was actually working with amputees. So we had, after either injuries or what would happen, it was just taking them through that early stages within they're having their operation there, and also fitting them with a prosthesis and trying to progress them on. That stage we were probably doing 3 or 4 week placements, so you got a bit of your teeth into it, but you were never able to kind of see them the whole way through from there. And in some of the placements I did, 3 or 4 weeks was enough. I'm not personally, I didn't massively like respiratory. It wasn't my thing at all. However, put me in an MSK or a rehab setting, I would have quite happily done that a lot longer. And that's even the way my career's kind of went now. Even within my rotations as a junior, I didn't tend to go down that road. I tried to push it more from an MSK point of view.
So when you did graduate then, what happened then?
So the last placement I did as a student was at what's called Gartnavel Hospital in Glasgow, which is still there, and I've gone really well with the senior at the time. So I did an orthopaedic placement. I had done one MSK just before that, and I had I think they had 2 or 3 jobs going at the time, and they kind of let me know that there's a chance that if I was to apply for it, I did relatively well. So they kind of advised that I do go for the interview, and I did, and I was fortunate enough to get the job in there. My first rotation was in outpatients as well. So I think I qualified in the May, and I started working probably mid-June. So I didn't really have an awful lot of time in between finishing and going down to work, and I've kind of worked right the way since then. Right,
yeah, no, it's always good. Like when you take that job then, I know you've been there previously, but do you feel like you're like nervous, or do you feel like you're like ready to go?
No, definitely not. It took me years to feel as if I'm ready to go. Definitely, even now we're learning. Obviously, you get more confident with it, but at first you would look at your patient list for that day, and everything was on paper at the time. There was no online notes that you could access, and you would read through and you'd think, right, this person's going to come in with this or that. And you had the very, very basic knowledge, and you would really have to research. So I'd spend a lot of time in the morning or in between patients trying to read up, right, this person's coming in with a tendinopathy, this person's going to be a shoulder issue, this person's coming in with a mechanical low back pain, and you would just do your best to try and read as much as you can about it. But yeah, and I mean, for years I would say that you're absolutely learning until you really get a degree of confidence that you can then pass on to patients as well. So yeah, no, it definitely was a tough start, I would say, but enjoyable, especially because it was more in the MSK side of it. With that, you see quite a variety, so I would probably say that's tougher. If you're maybe working in a respiratory ward at first, you tend to maybe see CFs, or you would see one area that the conditions are pretty similar. I think MSK, you're thrown into it and it could be anything that you see.
Yeah, and so do you think that was a really good grounding to have that sort of exposure then?
Absolutely, and then it does make a difference to people you work with. So at that point, they had a really good department that we worked in there. There was another couple of juniors that started round about the sort of same time. There was a couple of people that were maybe a year above me at university as well. So I kind of knew them anyway, plus just having enthusiastic seniors who would take the time to bring you into their consultations, which I found really helpful. One thing that I thought they were really good at initially is they didn't necessarily sit too much in with me. There's nothing, I think as a junior physio, if you're sitting treating a patient and you've got your senior sitting in the cubicle with you, sitting there listening, I think that's difficult. It's you're nervous enough, never mind that. So I felt going in with them and being able to ask questions at that time was really beneficial. And the way they worked that as well, they would maybe be about if I required them, but they'd never really be too much kind of in my face with it, which I quite liked. I think that relaxed environment certainly helped me to learn.
Oh, very good. So what do you do after that job?
So I did a few rotations within, I think I was in Glasgow for maybe about 18 months or so. Then we moved down to Northamptonshire, so I worked in catering in general. I got a senior 2 position round, so that was a junior. I actually went down there, as a junior as well, to work in MSK. Within 2 or 3 months I'd managed to get a senior 2, and I stayed there for just over a year before moving back up. So one of the reasons was it was my girlfriend at the time, but my wife, who is now, she'd got a job down south, so when she had the chance to move there, we thought, well, do you know what, let's give it a go and see how we go. And we potentially might have stayed there longer, but again, just with the way the job has worked out for her and both me, we then get another position up in Glasgow. But what I think working down in Northamptonshire allowed me to do was quite quickly go from a junior physio to a static MSK physio, which is exactly what I wanted to do. So it really worked out quite well. And again, the department of catering were brilliant, really good staff, good folk to work with. No one could understand me really for a while, but we got there in the end with it.
Did you see any differences between like England and Scotland in terms of that physio?
Well, one of the things is actually, time I always remember that we had with patients. I'm sure down in catering we worked 20-minute appointments, so it was 20 and 40 as opposed to 30 and 45, which even now we're working at kind of 45-minute appointments up here at the moment with it. So purely to see that volume of people and get them in and out, it was definitely a challenge as well. Waiting list wise, we were probably similar. I think we were always sitting probably 6-8 weeks round about that. Attendance rates would have been pretty similar. So I think it was good just to work with other people. As far as how the old department worked, I think it was probably just more the time aspect that I find was different. But again, you very quickly pick that up. Yeah.
So when you moved back up, what was that to do?
Again, so I moved back up. I stayed within the NHS, so worked in a kind of community setting, outpatients, was there for another 3 or 4 years, managed to get to a senior 1 level relatively quickly. Got a little bit frustrated, to be honest with you, at that stage with NHS. So they were piloting waiting list initiatives, and it was round about the start of when they tried to move more to phone triage. So before we had a really good department, worked to get the waiting list down, and then they introduced, as far as a Glasgow wide, there was a couple of sites we did as a kind of pilot essentially, and I was working on one of them. And I just felt that when I'd spend maybe 2 or 3 afternoons on the phone to people, and I would ask them what is it you've got, and as soon as they were saying knee, as soon as they were saying shoulder, you would ask them the main questions, but you were just sending them something out, and I felt as if I wasn't really. I didn't feel as if I was doing my job particularly well. I wasn't really enjoying it, and I had no choice in it. That's the way the system was going. That's the way the service was going, to try and cut down on waiting lists. And I probably, after about 6 months of doing that, I thought, you know what, I probably don't want to do this anymore. And then I moved into a kind of private clinic that I worked in, which we could then just concentrate on seeing patients. So I probably the last NHS, I think it was 6 years or so, and then that was the reason that I'd left. Sometimes I regret it. I think if I'd have just stuck it out, it might have changed, but at the time I certainly wasn't massively enjoying that side of it.
Well, what do you regret particularly then? What do you think might have happened if you'd stayed there?
I think if I'd stuck it out, then I might have, in a position of seniority, if you're managing to move up, you might have had the ability to actually then say, right, in my opinion, this doesn't work. We need to be, as a profession, I think even that's the case now, don't underestimate how important your clinical assessment of someone is. Even just spending the time seeing them face to face as opposed to over the phone is. I think that was really vital, and especially even now over the last sort of 18 months, I've done a lot of video calls and a lot of video assessments. It's nowhere near the same as what you would normally see, and I think from a patient satisfaction point of view, you get so much more out seeing you face to face, obviously when it's safe and we've taken all the mitigations that we had to do. So possibly, if going back to the question, if I'd stuck it out, I might have had an influence over it as I became more senior, but I was impatient. I was 27, I think, at the time, 26, 27. I knew I wanted to work in sport, so I worked in a private clinic. I then worked for one of the football teams up here part-time, and thought, right, that's where my career's going. So then kind of shifted a wee bit more in towards the sports side of it.
So when you did start doing that sport work, did you instantly think, yeah, this is what I want to be doing?
So yeah, I was lucky enough. I worked with Rangers at the time, so they had a new, relatively new training facility. So we worked with the youth teams, which was probably at that point 15 hours a week. So we would do any injuries that they had. We would review so age groups from under 18s right down to kind of probably under 11s at that time. They would come in and train in the evenings, and you would cover games that were on as well. Most games there'd be something happening, and we would also just treat injuries from there. And just try and essentially are patching the kids up at that stage. Again, it's mostly your load issues we were looking at. So worked there for, again, 2 or 3 years. Really enjoyed the sports side of it. Love football, that's my sport. So it got me the kind of opportunity to see how that works. And yeah, and from there that gave me a good background in sport to then progress on to a full-time position afterwards.
So is that what we do at Rangers then? So what was that, like the mid-noughty time then, or?
So the Rangers, that would have been, let me think now, so probably 2004, probably to 2006, round about then. So yeah, no, it was a good day. They had a really good youth system. They had a good team. They were successful at that point as well. And the medical department was starting to grow. There was maybe 4 or 5 of us were doing part-time stuff, and it was a really good time. I actually really enjoyed it. You're a bit isolated because you tend to work on your own. Because at night you're coming in and you're like covering physio, so you maybe didn't necessarily learn an awful lot from other people, but just to actually work in sport and get that experience was great. Yeah,
because I mean Rangers obviously an absolutely huge club, and it's great to see them back now in terms of.
Oh, that was well before that. Yeah, I mean, when I was working there was no signs of that at all. They were kind of pretty successful at the time, and the youth system was very well funded. I left there 2006 to go full-time with St Mirren, who were another team in the Premier League at the time. So that was full-time first-team physio. So that was a kind of natural progression. The club might not be the same size and stature, but as far as going into doing a full-time role within a kind of a football environment as a physio was something I always wanted to do. And then, as I say, so I started with St Mirren in 2006 with that.
Yeah, this, you don't have to get too into this, but like in terms of Scottish football, obviously, I mean, it's absolutely massive when you think of like Gaza, Laudrup, all of those guys, and then even you know when you were there, they're still a very successful club. Like, what are your thoughts on that, the way the Scottish football's gone?
I think that there was obviously, I mean, there's a lot in the press with it, and I probably don't know any more than has been written with it. I think the certain clubs are probably, we don't have the money as they do down in EPL, and obviously the finance that they're offering players has always been well above whatever was up here, and there's maybe a couple of mistakes made about trying to chase that and attract players up. Now it's kind of stabilised with it. I think now that the sort of players that tend to attract to Scotland are appreciative that maybe the wages aren't there, but as a platform, if you do well up here, then you'll move down south. And I know even now the level I still work in sort of professional football to some degree, players are ambitious, and they'll want to ambitious to go to bigger clubs in Scotland, and ultimately they want to go to bigger clubs in England or Europe. So I think as a pathway for people to go, Scotland's a really good place to work. Very competitive as well. With the football, but it does give you a good grounding to kind of move on in sports, and certainly from the players I've dealt with as well, they certainly feel that.
Yeah, well, Duncan Ferguson's my favourite ever player, so I've got a strong affinity for.
He wasn't here for long, but I think he went down to you guys and has done particularly well, and he's still, I believe, he's coaching, so he's yeah, a good career.
Yeah, no, definitely legends, absolute legend. So in terms of football, then, so you at St Mirren, how long were you there for?
So I was full-time at St Mirren for 2 years, and at that stage, again, for any kind of physios that are starting there, you're thrown in the deep end. So I had first team, which would have been about 20 odd players. I had reserve team, which would be, again, another probably similar amount, and we had the youth team, which was our under 21s, and there was one physio, which was me. And that's really, it was difficult. You're doing reserve games, and sometimes you'd be going Tuesday night up to Inverness, and the reserve game be 8 o'clock. You're travelling down, which is a 3.5, 4 hour bus journey, and you've been with the first team the next day. And that was kind of kept going on. Games at that time were getting changed for television, so sometimes they'd be on Sunday. So you were you're doing 6-7 days a week. There were long hours. You were dealing with you were doing the training, you were doing rehab for players. There was no real assistance, and that was a big learning curve, I would say, for 2 years, and it takes its toll. I think the more you do that. I had a young family. I think I had my daughter, who's now 16, was 2. My son was just born when I was there as well, was 14, and it probably wasn't compatible with a family life from there. So probably after 2 years, and I learned lots and actually loved aspects of it. And the team we were with at St Mirren, we were always in the lower end of the Premiership, but 2 years we were there, we stayed up, which is a big achievement for them as well. So it was really good, and you saw how happy the fans were and the players. It was a really good time. But I think after 2 years and realising, like, kids are really important age to be about to help out, I thought, you know what, at that point, I probably started to look for something else, and I was fortunate enough at that point to move into the job I'm in, well, similar job I'm in at the moment at Hampden Sports Clinic. So essentially a kind of private clinic within Glasgow, mostly based on sports rehab. But having done the background at Rangers, having done the background at St Mirren as well, at different levels and the pressures that bring, actually to go back into a clinical setting working with other people was really good for me at the time. And I've been here now for 12 years, I think it is now, so a little while.
Yeah, no, that's great. Yeah, I'll ask you about that in a second. But in terms of St Mirren then, so when you would go in there, so you're doing physiotherapy, but would they give you complete remit in terms of like strength and conditioning? Was that something that was being looked at then?
So that was the early stages. We actually had a sports scientist who, we actually had a couple when we were there, but the first guy I initially worked in was a guy called Jamie Ramsden, who's went on the ice. Fun enough, as I went from Rangers to there, he went the opposite way, and a year after me. He was really good. So my exposure to S&C before that was very little, and I think that's, even when it might be slightly different now, but certainly as when I was qualifying in the first 2 years as being a physio, there wasn't really much information. There was no tie-up with S&C. So working with Jamie at that time, he dealt with S&C, and we tried to link in a rehab with S&C. So I would take them to a level. I certainly wouldn't keep hold of the player. I would want to push them relatively early on to S&C, because there's a lot they could do with regards to kind of loading the injury and improving that way. And there was lots they could do that was out with injury, so they had to keep fit, they had to maintain their cardiovascular fitness. And actually working with a full-time S&C coach at that stage was excellent, and it opened my eyes up to quite a lot. And even now, a lot of what I do and my rehab side of it has been learned from working with a variety of different S&C people, but Jamie would have been the first one I worked with, and he was certainly very good.
So then when you wanted to move to Hampden, then what was it particularly about that? Because that's got a bit of a hybrid. I mean, I've been up to your facility, very impressive. You've got a very much elite sport feel to it as well.
Yeah, I think it was partly it was just that I just wanted probably the change to go away from certainly one of the reasons for the 6-7 days a week. I wanted to see, right, kids are young, 5 days a week from there. I went to work. I wanted to have a mixture of sport, and I did, even though within football, I still really enjoyed the previous MSK outpatient side of it, and I still, even now to this day, I still enjoy it with this. So that gave me the ability to do some sports rehab, to do some normal MSK outpatient stuff that maybe necessarily wasn't the sporty person. And also within the role here, I had the opportunity to start working with national teams. And I've been quite fortunate again since I've been here that work with a lot of the different national squads. So that benefit is that you see them, you get to travel a little bit. Again, the players that you get, it's different because you're borrowing them from clubs and you really need to take care of them. But you're not necessarily dealing with injuries. You're not rehabbing anyone. You've got them from a 10-day window or a 7-day window. And the focus of that camp is to keep that player fit, make sure they're ready to go for whatever that 1 game or 2 games, which is a slightly different way of looking at it to what I saw before. So I think by just getting back into the normal working environment with seeing patients, working with sport, and also working with national teams is the kind of probably 3 main reasons I decided to move at that point.
Whose shirt is that out of interest, number 19?
I think a couple here. I think that might be either Kevin McDonald, who played for Fulham, or Scott McTominay at the time. So he played, the one I've got there, that was, we played Belgium, Lukaku, Hazard, De Bruyne, and I think we lost 4 at that point, 4-0. But to be fair, they were an incredibly good team at that stage. So I've got a few shirts kind of kicking about with just different ones from there. Sorry, I can't remember if that's Kevin. I think it might be Kevin, obviously.
Yeah, no, very good. So yeah, so in terms of that then, what's the breakdown of your week then, or your time? Is it a lot with the Scotland team or private clinic or both?
Not necessarily. So the majority of the stuff I'll do, I've done a bit with the first team, but the majority of stuff I have done in the last 7 or 8 years has been with under 21 squads. So I manage at the moment Scott Gemmell from there. Then and Scott's an excellent coach, and I actually see from a person who likes football to go in and work in that environment where you see training and you see guys at the top level and how they tailor training is really, really enjoyable. As I say, I've always kind of, even if you go back to what I was saying at the very start, football was always my thing that I enjoyed, and obviously got kind of a few injuries, hence why I led into physio. So now working in that environment is brilliant. So I'll go away. You tend to work in international windows at the moment. So you've got your September, October, November, 10-day or 7-day camps where you're going away and you'll play whoever's in your squads. And then you have a bit of a gap right through to March where you've got another international window. And I think there's one just before the summer. So your time is relatively you're there and you're there, it's intense, but the rest of the time that I'm not necessarily away with the squads, I sort of manage the clinic in at Hampden. So I'm still mostly clinical based, but we've got obviously quite a number of staff, physios, podiatry, sports science, sports massage. My boss is a clinical director who's a sports medicine doctor as well. So management, patients and football, which I think is a really good mix, and I certainly really enjoy it from there. Quite fortunate as well.
Yeah, no, definitely. No, it's a great setup. So what is like the main sort of vision for the clinic then? Like where do you want to take it?
We're starting to expand to an extent. So we've recently opened up a clinic at Glasgow University, which is in the west. So we stay south side of Glasgow. Hampden Park is in the south side of Glasgow. So Glasgow University is based over in the west end, which is maybe sort of 4 or 5 miles away. And so we've got a clinic in there now, which is a lot smaller, but we're starting to build it up. And also we have one within Strathclyde University, which is a new clinic we've just started. It was due to start literally, I think it was April 2020, but it was put back. So we've really just started to run that this summer. That's in the city centre of Glasgow. So probably my aims at the moment are to try and expand the clinic. So basically get us out there to more patients. We've got a good spread now within city centre with the West End and the South Side. So part of my remit at the moment is to try and expand on that and get good staff in that want to work, and we're certainly very fortunate at the moment. We've got a really, really good team at Hampden who are pretty static. We don't get an awful lot of turnover, but we're in the process of trying to expand, and we're advertising at the moment for more staff, just as we're trying to build on as well.
Oh, great. No, it's good. Well, Strathclyde, I remember doing some work. They've got a prosthetics department there, haven't they, as well?
Absolutely. So they've got, I had a tour of that actually a couple of weeks ago. The facilities there are absolutely fantastic. So they're doing a lot of research stuff. And actually one of the people that works in there had spoke to me just about, I think it was actually ankle instability it was, and how we could probably tie in within that. So that's at the early stages, but their facilities they've got is honestly second to none. We are slightly different as our clinic is more based within the new sports department. So they've built a brand new gym, facility with a pool, gym. We've got just as everything you would expect from a kind of top class university from there. And they're trying to, they're kind of sports scholars that they've got. They're really trying to build on that as well then, and how we can help them is to try and provide the kind of sports medicine expertise if they do have any issues with the rugby teams, the netball teams, their athletic teams, and we'll try and provide a service for them there, as well as having a clinic that's open to the public. So it's almost like a little hybrid model where we work, yes, with the university athletes and the university students, but also we're also open to the public as well from there.
That sounds great. I look forward to coming in and seeing that when we're able to do so. And in terms of for you then, like, have there been any particular people, whether it's in the medical profession or not, any athletes you've worked with or patients that have been like inspirational to you or that have had a big impact on you?
Good question. I think it'd be really unfair just to kind of pick out one or two when there's been, I mean, so many different people that I've kind of probably worked from over the years. I mean, if you really pushed me on it at the moment now, our clinical director, Dr. John McLean, who's he's been with the first team for Scotland for a number of years now. John has been great. So I've got good relationship with him, that anything as far as from a management point of view, we go to him and he ultimately makes decisions, but we kind of bounce off each other well. But also from a clinical point of view, having actually a really experienced sports med doc, but you can ask, if it's out with my comfort zone, I'm not sure, I know he's 2 rooms away, and we can certainly chat from there. And I think from a patient point of view, that's another real bonus that we have within the clinic. So if it's something out with my field of expertise, or I think that, you know, that's more medical than physio, I'm not sure about that, or what tests do we need to be asking if they're going for bloods or for scans. So I think just getting that information from John. So I would probably say him. Going back sort of years ago, I certainly the seniors I initially worked with as just when I was starting to qualify were very, very influential as well, when they kind of certainly piqued my interest a little bit about what was out there and how I could learn and how I can improve. So a lot of people, and I think as a physio, you need to learn off the good ones. Okay, take what they need to do, and you need to tailor it yourself as well. But there's a lot of people, really, really good, influential, enthusiastic people out there that I've learned from that I'm very thankful to have worked with.
Great. No, well, I really appreciate your time today. So thanks for fitting me in your lunch break. So I appreciate that. And yeah, I'll look forward to coming up and seeing the new centres when you're up and running.
Yeah, no, we look forward to having it up. We look forward to people getting back into, as well as we're doing a lot of stuff on Zoom. It's nice. We're transitioning back into kind of face-to-face stuff a lot more now, and seeing yourselves and anyone else would be good.
Perfect. Great. Appreciate that, Alan. Thank you.
Thanks for that. Cheers.